Good afternoon, everyone. Welcome to our COVID-19 update for March 2nd from the Rath Building. We have some important information to share, including some eye-opening information with regards to COVID vaccination rates by zip codes in Erie County. Of course, we'll be joined by Dr. Gail Burstein very soon. We also have Kendra Schmidt here from Deaf Access Services who will be providing the American Sign Language. But let's just get right to it. As of February 28th, there were confirmed 64,838 unique COVID-19 cases. These are all individuals. We are seeing a continued drop in the hospitalization and positivity rate. The positivity rate has dropped to 3.5% for the 7-day period that ended on February 28th. Hospitalizations in Western New York, there were 190 people that were hospitalized for COVID-19 in Western New York. 45 of those were in the ICU. When it pertains solely to Erie County, there were 156 patients in Erie County hospitals, of which 35 were in the ICU. 28 of those individuals had an airway assist. Unfortunately, 2 additional individuals died in Erie County hospitals from COVID-19 on the 28th. And as of the 28th, 47% of the patients were age 64 and under who had COVID-19, so roughly half of the patients were under senior aged. Diagnostic testing summary. We continue to see the positivity rate go down. It has gone down for basically the last month. The prior week, which ended on February 20th, the positivity rate was 4.3%. It is now down to 3.6%. There's a slight uptick in actual confirmed cases from the previous week, but we also did approximately 9,000 more tests. So the positivity rate actually went down, even though the number of cases actually increased slightly from the week before. Looking at new COVID cases by zip code, this is a good thing to see, except for my hometown of Lackawanna. What's going on there? We have positivity rates generally in the 3 to 4% category across much of Erie County. Some are actually in the 2s. My hometown of Lackawanna had the highest number for one of the larger municipalities at 6.7% last week. So let's get it together, sunny LA. Let's get that number down. But it is good to see that overall, including in some of the areas we had significant concerns for a long time, the number is going down, especially the town of Hamburg, which unfortunately had led for many, many weeks the number of cases and the highest percentage rate, and it has dropped too when you look at the overall percentage rate and the new cases per 100,000 population. So in general, it's better. It is, we're seeing across the state and the country, numbers are going down, and we think that's a combination of a number of factors, including more vaccines getting into the arms of residents. Hospitalization data, the 2-week chart from February 15th to February 28th, 68.5% of all beds in Erie County are occupied. We want to see that number continue to decrease. We actually have, for a while there, saw an increase in the occupied beds, but not necessarily for COVID. Dr. Burstein and I have conversations with leaders from the hospital systems, and the one that we had last week indicated that there was an increase in overall bed usage, but it was not necessarily because of COVID. It was just because of other issues that people were dealing with. And of those are in the beds as of the 28th, 22% are hospitalized in an ICU bed. Of course, in an ICU bed, you're much more at risk of death because you have a serious illness. And as we noted, approximately 50% or 47% of all COVID-19 patients are under the age of 65. And as we know, when we talk about deaths, it is those over the age of 65 who unfortunately make up the vast majority of our deaths. But just because you are younger doesn't mean you can't get sick. You might not die, but we have seen, unfortunately, people under the age of 60 die under the age of 40. And as we look at this chart here, this is as of February 25th. There were 1,651 COVID deaths in Erie County since the beginning, which later this month will be coming up on the one-year anniversary of the first death in Erie County. But there have been 110 people who died in Erie County in the month of February. So we still have a few more days to confirm in the month of February, but it's very sad. We did see individuals under the age of 40, under the age of 50 pass from COVID in the past month alone. And we offer our deepest condolences to all the family members and friends of those who've lost a loved one due to COVID-19. While the vast majority of individuals are over the age of 70, not everybody was, and we lost a lot of people in the primes of their lives. Erie County response. We're going to talk about the vaccine. Through February 28th, 15.3% of all Erie County residents, or 141,415 people, received at least the first dose of the vaccine, and almost 10%, or 9.6%, 88,000 people received the second dose. That is all clinics, county, state, at pharmacies, at hospitals, all clinics. That number is starting to increase on a weekly basis because we are starting to see more doses come into our region. Through February 28th, the Erie County Department of Health has administered 25,588 first doses and 18,481 second doses. We would have loved to have seen those first dose numbers be higher, but we just didn't get a lot of doses. We're starting to get them now. We got some good news to announce. Wasn't that long ago, Erie County was receiving, as the County Department of Health, no more than 1,700 doses a week. And for the county, all places that were providing vaccine, about 6,000 doses per week. Erie County Department of Health for this upcoming week will receive 7,280 doses, first doses. This doesn't include the second doses we'll be receiving, just first doses. And we believe, based on the numbers in the spreadsheets we've seen, when you include all the locations, the Erie County locations, the state locations, not including Delavan Grider because that's a FEMA location, but pharmacies, federally qualified health centers, more than 20,000 first doses will be sent to Erie County to all of the participants in the next week. We will be receiving 7,280 vaccine doses, which are to be allocated in the following manner. This is how it's to be prescribed by New York State. We've been fighting for more doses. I was on the phone with Larry Schwartz, the vaccine czar, late last night. We're getting more doses, but there is an allocation system. 1,770 of those doses will be for essential workers. For those that reside in New York State Office of People with Disabilities, Developmental Disabilities, Housing, 300 of them will go for their residents and staff, and we believe we are exceptionally close to vaccinating all residents and staff that are in developmentally disabled congregate settings. 1,570 of these will go for the comorbid population, and we will continue to share vaccines with hospitals so they can do their most at-risk out and inpatients, not just inpatients, outpatients at their clinics. So 1,570 of those will go to hospitals for that purpose. And then 3,640 doses are to be allocated solely for individuals 65 and older. And we are starting to notify individuals who previously signed up on our wait list that are 65 and older on how they can schedule an appointment. Now, it's very important. We know a lot of people want the doses and they're trying to get them, but they may not be able to get them for various reasons, including the limitations on particular clinics. This is an example of it. For individuals 65 and older, those doses will only go into the arms of individuals 65 and older. And if anybody else attempts to get those doses, even if they should happen to get an appointment, if they appear at the clinic and they're not 65 and older, they will not get the dose. Erie County has finished rescheduling the January canceled appointments. We've given everyone that had a canceled appointment plenty of opportunity to reschedule. We sent out many links by email. If you did not reschedule your appointment, you can call us at 716-858-2929, but we are done rescheduling the January canceled appointments. We got through the month of January. Yesterday, the Erie County Department of Health coordinated a closed, not open for everyone, closed point of distribution clinic for Phase 1 essential workers for police, fire, and transit workers, yesterday and today. This was not open. If you went to the state site and looked for it, you called the phone number, you didn't find it. We sent out registration links to individuals who qualified for that. I'm going to go into a little bit about this, but this also pertains to the 65 plus age category. We're sending out registration links specifically to those in the 65 plus category who previously were on the wait list. They will have an opportunity to sign up for a clinic later this week to get their dose. If you are not 65 plus and you get the link, You might think, hey, I got the link. I can go out there now. My grandmother got the link. She just shared it with me. I can go out there and sign up. Even if you are able to sign up through the website, you will not get one of those doses. They are specifically designated for our senior population. And as we've seen, they are the ones that are most at risk for death. Anybody 65 and above. So, for the pod that was scheduled yesterday and today, we specifically sent out information on this being a closed pod only for those in particular occupations. First responders and support staff of first responding agencies, including fire service, police, investigations, public safety communications, others such as court officers and the like, and then public transit. These are front-facing individuals who deal with sometimes hundreds of different people a day that are at most at risk for becoming COVID-19 positive. So the state asked us to do specialized pods for these occupations. This is a copy of what was sent to the individuals who signed up for this pod. And if you look at the bottom of this link, or this page, it does note, please do not share, forward, or post these links. The information is not intended for the general public. All persons will be screened at the door, or anyone without official ID confirming that they are part of this occupational group will not be admitted. What happened, we believe, with some of the pods yesterday and going again today, is the information was shared with individuals who might have been in the 1B category, but did not qualify to receive these vaccine doses because they were not part of these occupations. And so when they filled out the form online, which was shared to them because they couldn't have found it any other way, they would have come up with a certification in which they certify that they qualify for the pod. After they fill out the form, they get the proof that, hey, I got an appointment. They then, after certifying that they qualify for the pod, got notice. And you see the second page of the admissions ticket, which notes, here are the things you're going to have to bring. And oh yes, by the way, you just certified it. These are the only occupations that qualify for this closed pod. We've done closed pods before. Sometimes they're for individuals in congregate care developmentally disabled centers. Sometimes they were 1A healthcare workers. What we're trying to do is get vaccinated the most at-risk people in the general public now, and I think it's fair to say we all know that police, fire, and transit workers are those that come in contact with individuals from across the community all day, including individuals who are higher risk than others. So this is the appointment. This is actually an actual appointment slip that somebody received that was a non-qualifying individual. And when the individual at the door showed him, your appointment slip says you don't qualify, the individual was like, well, I got the appointment, just give it to me. We couldn't. We did have to turn away individuals because they didn't qualify for that particular clinic. As a result of approximately 100 out of 1,000 appointments having been taken by individuals we had to turn away, we were working the phones, calling these other individuals who were unable to get appointments but qualified so that they could come and get the doses. No doses were wasted. There were some rumors out there, doses were wasted. Not a single drop of the vaccine was wasted. All doses were used. We contacted individuals that qualified for the 1B clinic, police, fire, related entities, as well as transit employees, and got them doses. We're still going to have to finish off more people, we believe. We're going to do those in individualized task force pod settings. But this just goes to show, we know a lot of people want the vaccine. We understand why, but we also have a responsibility to meet the obligations that we have from New York State and to truly get done those in this 1B category who are most at risk, and those are front-facing employees like police, fire, and transit. So I just, on behalf of the people in Erie County who may have received an appointment and they weren't supposed to, and as noted, whoever sent you the link was not supposed to send you the link, and they knew that. I know people think it's a free-for-all, I'll just get an appointment and I'll get it. We have rules we have to follow too. And so we're following those rules. And the same thing will apply in the upcoming week with the 65 plus category. If you sign up for a vaccine, then the 65 plus pod, even though it says it's for 65 and older, you will not get it if you're under the age of 65. We are going to do 1,770 general population for the 1B category in the upcoming week. And so there will be opportunity for others, but we want people to understand that we have some rules we have to follow, and we do it so that it doesn't become a free-for-all, and we can get those that are most at risk vaccinated first. Now, I want to go through something that is very disheartening, but it's not totally surprising, and it's numbers we've seen. This is why you see the state-specific pod at the Delavan Grider Center for only 10 zip codes in the city of Buffalo. Basically, if you live in a wealthy suburb, you probably either have gotten the vaccine or you have a much better chance of getting the vaccine. If you live in a poor area or a rural area, you've had less of a chance, and you certainly haven't gotten it to the same degree. Gowanda has the lowest percentage of its citizens having been vaccinated at 2%. The next, what appears to be 10 zip codes, I think, is the city of Buffalo zip codes, in which they vary from 4 to 6 to 7. The average in the city of Buffalo for most of these zip codes is around 6%. So we know the numbers of the individuals who live in the zip codes, and we know the individuals who actually have received the vaccine. We can break it down by their street address and their zip code. If you look at the top vaccination distribution by zip codes, there's some huge inequity in our community. The top 3 are all related to the town of Amherst, in which every single one of them is over 20% of their population has received the vaccine. And remember, the zip code population also includes those 18 and under who don't, or 17 and under, I should say, who do not qualify. So when you look at the 14068 Amherst-Gettsville zip code at 27% of the population, that probably means that the overall individuals who qualify for the vaccine is probably over a third or more who've received it, as compared to parts of the city of Buffalo, including Cheektowaga, in the east side of Buffalo, in which it's 5%. The state, working with the Federal Emergency Management Agency, opened up which actually I should say opens up tomorrow, a point of distribution clinic in which the first 2 weeks of times were reserved for individuals from 10 zip codes. It's actually longer than 2 weeks now. I just went on the site and looked. There are approximately 7,000 open appointments from March 14th through March 23rd. If you only live in the zip codes in the bold, the dark color, the black, you can qualify to receive a vaccine by signing up now. At 8 o'clock in the morning tomorrow, New York State will change that. We just received confirmation that the vaccine site at the Delavan Grider Center, all those appointments that are open tomorrow, right now I should say, and those that are in the month of April, there's about another 7,000 in the month of April, will be open for anyone who lives in Erie County. We originally heard it was going to be Western New York. We've now heard from New York State it is going to be only Erie County residents who qualify. So I am stressing to everyone in Erie County, at 8 o'clock in the morning tomorrow, we know thousands of appointments are going to be available for March and April at the Delavan Grider Center. Erie County will be announcing thousands of appointments, as we've just talked about as well. Much more vaccine is coming into our community. If you live in one of the 10 bolded zip codes on that page that you see on the screen, and you want a vaccine, you can get it by calling 1-833-697-4829 right now and scheduling an appointment. If you live in the 14201, 204, 208, 209, 211, 212, 213, 214, 215, and 222 zip codes, you can call the New York State hotline. And if you qualify because you're in the 1A or 1B category, this includes seniors 65 plus. This includes individuals with comorbidities. This includes teachers. This includes fire, police, and transit that we haven't gotten to yet. You call 1-833-697-4829. Right now, you can schedule an appointment starting on March 14th through for March 23rd, and I know there were approximately 7,000 plus available half hour ago. And there's another 7,000 plus for April. At 8 o'clock in the morning tomorrow, The site online and the phone call number will then open up for all Erie County residents. So if you do not live in those zip codes and you want an appointment, I'm pretty certain there's going to be thousands of appointments available for March and April available starting at 8 o'clock in the morning at the Delavan Grider site. This site was only supposed to be there for basically a month. It has now been extended for 2 months because it is all the way going through April now. And we know that it will actually have to go into May because they're going to have to provide second doses at the same location. So there are opportunities to schedule appointments in our community. We want people to take advantage of them. If you live in the 10 zip codes, please take advantage of them. The state and the federal government gave you an opportunity to get out in advance and get some appointments. And why? Well, it's pretty clear. The city of Buffalo as a whole has some of the lowest rates of vaccination of its residents across the board. And I want to say this is not just a race-based thing. There are zip codes here which are predominantly white in the city of Buffalo that have some exceptionally low numbers as well. It is disappointing to see areas that are generally more poverty-stricken having such low numbers compared to those that are so affluent. Look at the top 3 towns for vaccination: the town of Orchard Park, the town of Clarence, the town of Amherst. They are the 3 most affluent towns in our community. And then you look at the other ones in Gowanda. Gowanda is not a poor community per se when you consider it as a whole, but it is not as affluent as others. And you see those that list of rural and the city having such low numbers. We want people to know that the sites are available. The county does vaccination at our sites at ECC North and ECC South. We do have a site for ECC South, but these are all by appointment only. You just can't walk in. We are looking at opening up next week a 3rd site in the city of Buffalo, not the convention center. When we are ready to announce that, we will announce it. But our goal is to open up next week another site for Erie County because we're going to be receiving more vaccine doses. The convention center, we have not gotten approval from New York State to do a mass vaccination site, but we do believe we need a site in the city of Buffalo. So we'll be adding another site, which will be in addition to the state site, which is at UB South, as well as the state FEMA site at Delavan Grider, and other federally qualified health centers that currently receive doses. With that, I'm going to turn it over to Dr. Burstein to get into the nitty-gritty about some of the new guidances.
Thank you. So I think many people are aware that at the end of February, New York State announced some new guidance for sports tournaments that are non-professional and non-collegiate. So in Erie County, we have amended those a bit, expanded a little bit, contracted a little bit. So first of all, we are welcoming of tournaments for teams that travel from within Western New York or within the Finger Lake regions into Erie County for a tournament. Everybody still has to adhere to the New York Forward guidelines, so all facilities cannot exceed 50% of their capacity for any event. And for participants or players or coaches that travel from outside of Western New York or outside the Finger Lakes to participate in a tournament or games inside Erie County, we are requiring a negative PCR test that was collected less than 72 hours before the start of the participation in the tournament. So that is only for people that are coming from outside of Western New York or outside the Finger Lakes. So all the players or participants and coaches that are coming from inside Western New York or inside the Finger Lakes are not subject to these testing requirements. And still, anybody who has any positive player or coaches obviously cannot participate. And any teams with a positive player or coacher a coach also cannot participate. We're going to ask them to take a pause. I want to learn our lessons, especially from what we've seen with the Sabres and the New Jersey Devils, that there was transmission playing on the ice. We don't want that to happen again, so we're really limiting any teams from participating that from wherever they're coming from, even in Western New York or the Finger Lakes, if they had somebody on their team who had tested positive for COVID-19 in the past 10 days. So if facilities are planning a tournament, the Erie County Health Department, we want to know about it. We want to make sure that you're planning a safe and fun event. So you can, to inform us, you can go to our website at erie.gov/health/event notice to let us know at least 5 days before the planned tournament about what you're going to do. Let us know what your safety plan is. We'll work with you to make sure that the event is fun and safe. So just a reminder, like everybody, all the events have to comply with the New York Forward guidelines. That's what we're all adhering to. And these restrictions, these requirements actually are going to go into effect March 5th, so later this week. So all these requirements are going into effect March 5th. And the march, oftentimes in Western New York, signifies the beginning of the outdoor event season. So I know that many people are thinking about planning outdoor events like parades and catered events. So just want to remind people that many of these New York State Forward rules have not changed. So any in-person events, either it be indoors or outdoors, are limited to 50 people for a non-essential gathering. And if people want to have parades, the New York State New York Forward is allowing parades in people in vehicles. So you can have, I know, people did over the summer, some type of vehicle caravans. That's permitted, so people are in a parade inside their vehicles, driving down a street where people can cheer. And all participants in these caravans have to remain in their vehicles, except if they need to use the toilet. Broadcasting these events are encouraged instead of in-person attendance, so live streaming on YouTube so people can watch is really the preferred mechanism, especially on a cold day like today. And we also are encouraging that anybody that is planning an event, including municipalities, to contact the Erie County Environmental Health Department at 716-961-6800. And again, we really want to help you plan a safe and fun event. So please contact us again at 716-961-6800, and we can help you make sure that you have a safe and fun event. So just also want to remind folks that the Erie County Health Department is still offering free COVID-19 testing. It's important that people know their status. We've heard that nationally COVID-19 testing has dropped off. In the past week, we saw a little bit of an uptick, as the county executive mentioned, of COVID-19 tests, and that's good. We really want to find people that are positive so we can reduce the chain of transmission and keep these numbers going down. So the only requirement that you need for a test is an appointment. So to make an appointment, you can call 716-858-2929. Erie County residents can access either a free diagnostic testing with either a polymerase chain reaction or PCR test, and those results are going to be available between 1 to 3 business days. Or there is also rapid testing available, and those results are obviously available on site within a half hour. Sorry? I did. Oops.
One more.
Thank you. Sorry. Thank you, County Executive. So I glanced over the weddings and large catering events because those are very, very important. I know that people are, they've been waiting for a year to reschedule many of these weddings and large celebratory events. And finally, we're going to be able to do that later in March. With the Erie County Health Department, we really want to make sure that help you have a safe and fun event. So for indoor and outdoor events, like weddings, weddings or any other type of catered gatherings, the Erie County Health Department needs to know about it so we can help you plan a safe event. So again, if you go to our website at erie.gov/event notice, you can complete the safety plan and we can review it. A sanitarian will review it and give you feedback and make sure that you're hosting a safe and fun event. And we need that information at least 5 days before the event. There is going to be testing requirements for events that have either between 50 and 150 people. So those are all information is also available on our website because the test has to be done within a certain time frame before the event happens. And if also for facilities, if they want the health department to go do a walkthrough and help you with your planning, we are happy to do that. So please call 716-961-6800, again, our environmental health office, and we will be happy to schedule an appointment to walk through your facilities and make sure that everything is safe and fun. Also, March is a time where we remember our loved ones that have passed away from our opioid epidemic. And March 6th is Black Balloon Day, and we are going to celebrate that again, and we are going to celebrate virtually. So there's going to be information about balloons and how to log into this virtual event that are going to be distributed at community sites, and this is going to be these are going to be distributed between Saturday between 12 and 4 p.m. Individuals will be able to collect their balloons, and we really want people to display these black balloons to remember our loved ones that have passed away from the opioid epidemic, our victims, in homes, in businesses, just so people know that they're not forgotten. We are remembering. Nobody is forgotten. So we are going to have a virtual meeting by WebEx on March 6th at 4 o'clock. And we are going to read off the names of all the people that have been lost that we're aware of from the opioid epidemic and remember our loved ones. Remember, no one is forgotten. So with that, I'm going to turn it over to the county executive to answer questions.
Thank you, Dr. Burstein. I did not come as Natalie attired as Dr. Burstein for St. Patrick's Month. And we know that people are disappointed that there will not be the parades. The two parades that are generally held for the month of March, unfortunately, will not be held. And the same goes for Dingus Day Parade. We want people to understand that traditional parades can't be held. In the vehicles are okay. If you just stay in the vehicles and you drive around, we don't have a problem with that, but the parades where people gather, they get together on floats, you have thousands of people along the side of the road, are just too dangerous. And so to the folks who put those parades together, we just want to say we understand your disappointment. It's 2 years in a row now for the St. Patrick's Day parades in Erie County, but one of the reasons it's 2 years in a row is because we unfortunately are coming up to a very solemn anniversary, which is two anniversaries, which is the first case in Erie County, March 15th of 2020 was announced, and then the first death, which was later in the month of March of 2020. So we unfortunately will be not only having Black Balloon Day to honor those who we've lost as a result of the opiate epidemic, we will also be having a ceremony later this month in which we light the Old County Hall once again in amber to honor those we've lost as a result of COVID-19, the more than 1,600 of our fellow residents, I should say. We will open it up to questions. Once again, just remember to unmute your line, *6 when you are called upon. We'll start actually with Spectrum News because we have Brendan here. Why don't we start with Spectrum News? Do you have a question or shall we go to Aaron? Okay,
Yeah,
Aaron, go ahead.
Actually, a question about the Johnson & Johnson vaccine. I don't know if Erie County is expected to get any this week, but I'm assuming we're going to get some eventually.
Mm-hmm.
Are there any groups of people or locations that are going to be better served by that single dose I know your counterpart in, I believe, Onondaga County suggested maybe homeless people. Maybe it would help with those zip codes that are underserved. Do you guys have a plan for those?
Yes, we do. Our goal is to vaccinate as many people as quickly as possible. The Johnson & Johnson, of course, is a one-dose vaccine. The amount that we announced earlier, the 7,000 plus for Erie County, does not include any doses of Johnson & Johnson. However, we've been advised we might receive by the end of the week 200 doses for homebound residents. So we are going to provide those doses to individuals who are in a homebound situation. So in other words, they don't leave the house. We have identified, what can I say? We know that there's the issue with the nuns. We will be vaccinating the nuns that have been unfortunately unable to get it. They qualify based on age and they're homebound. And we will also be vaccinating a senior complex that is homebound. We are trying to get more information on those that are truly homebound. Not just, I don't want to leave my house to get the vaccine, but those who can't leave their house, can't leave their apartment, their place of living because of their frailties, basically. So we will be providing the Johnson & Johnson vaccine to the homebound community, and as we get more of those, we will also be providing them to others at what would be considered some of these riskier settings, but maybe not as much as a risk as, say, the people who are getting the vaccine right now because they're front-facing workers and the like. So we're hoping, we've been told, that by the end of the week we should get 200 Johnson & Johnson doses. It's not a lot, but it should be enough to get a couple of these locations, including the nuns, who are probably hearing this for the first time. They don't 100% know that. That was the plan we were working on, and we can announce it now. So we'll be doing those nuns that unfortunately were homebound, and we'll be doing more homebound individuals with the Johnson & Johnson vaccine in the near future, but it's also going to depend on the number of doses that we receive. WKBW TV, Channel 7.
Hi, Mark. How are you?
I'm okay. It's a good day. Whenever we get more vaccines, it's a good day.
So you briefly mentioned that there would be a second mass vaccination site coming to Buffalo. We know it won't be at the convention center. Will it be, do we know, downtown, in specific areas catering to specific zip codes? Will it be designated for certain eligible groups? Can you give us any more information on it?
We're not at liberty to announce it at this point because we still have to lock up some of the ramifications of the site, the contractual obligations. It will be no different in some ways than doses per day than what we're able to do at the North and South clinics. We can do up to 1,200 doses per day. We know we can, based on this facility, we could do 1,200 doses per day. Our goal is to not limit it to any one particular unless we're doing a closed pod. So it would be like the other county sites. If you get an appointment and you want to choose that site, you could go there. Our goal, hopefully, is to announce it by the end of this week so that we can have it up and running next week. WIVB TV, George Rickard, I believe, is there. George? George, are you there? Yeah, *6 your phone if you're muted.
Mark, can you hear you now? Can you hear me now?
Yes, I was worried you were in a snowbank in Springville.
I know. Sorry about that. I was yesterday. Can you comment on what the governor is going through? 3 women have now accused him of impropriety. Do you have any reaction or comment on that?
Well, on Saturday, of course, I came out forthright and said that there needs to be an independent investigation. You have 2 women who worked for the governor who've made accusations of sexual harassment. As I noted then, the allegations were such that if they were performed by any superior against an employee that works for them, it would really be unconscionable. It would be unacceptable. But you also need to have an independent investigation. At that time, the governor was trying to have this one judge appointed to do the investigation. I said we need a truly independent investigation. That has now moved forward, as Attorney General Letitia James has now been given the power to do it. And I think it's important that the investigation go through, because we do need to have due process. There's no doubt about that. The governor is entitled to a defense, so to speak. But I was pretty mad when I saw the story on Saturday in which the governor pretty much corroborated that he said some inappropriate things. They're not just inappropriate. I mean, I'd never think about saying that to one of my employees. I don't even think about saying that to some of my friends, nevertheless ask them about their sex life. And then the issue that came out last night is totally, the one word that came up to me is creepy. It's not illegal. As an attorney, I know that people can walk up to individuals that don't work for them and ask them questions, especially about things like that. It was just creepy to know that the governor allegedly asked a woman who he had just met, "May I kiss you?" and put his hands on the head of the individual. I've seen the governor do that in settings with other individuals where he's grabbed them, he's embraced them, he's put his hands like on the side of their head. He can be a touchy-feely politician, and some people love it. I've seen people absolutely melt when the governor does that. I mean, I think most people know I'm not the most touchy-feely politician, not the biggest backslapper. It's just not my nature. For some people it is. But yeah, I read the story last night, and it was just creepy. I mean, seriously. You just meet the person, and I don't care who you are. I don't think that's what you should do. Is it illegal? It's not illegal. It's just creepy. So I believe the Attorney General should have full carte blanche power to investigate. It's my understanding, I'll say this, it's my understanding the current law provides that the governor is entitled to, as the appointing authority for the Attorney General, is entitled to weekly updates on the investigation. I don't think that's appropriate. I don't think the Attorney General should have to turn over information on the investigation against the individual as technically being investigated. I think they should have a thorough investigation, independent investigation, and if it's determined that the governor sexually harassed individuals that worked for him, it's exceptionally serious, and he may have to resign at that point. If it's determined by an independent investigation that he acted inappropriately, I know how we have a system in Erie County through our Department of Personnel and our Labor Relations, and sexual harassment cannot be tolerated. It's as simple as that. And but we also have to let the investigation go through its course. He is entitled to due process. WGRZ TV, Kelly Dutzig.
Hello. So most of the questions we're getting from people who want to get the vaccine but aren't able to find appointments are from the 65-plus age group.
Mm-hmm.
And I know that there are going to be some county clinics available to them soon. What is your best advice for them to get an appointment? Do they have to be on this waiting list or go to a pharmacy, as was the case before?
Well, it's both. We have the waiting list. We now have authorization. Remember, at this point last week, we didn't have authorization to do 65-plus. So we were telling all those that were seniors, your best bet is getting it through pharmacies. Out of the 20,000 or so doses that are coming to Erie County locations, not just the Department of Health, I can confirm about 6,000 of them are to go to pharmacies, all kinds of pharmacies, large pharmacies, smaller pharmacies. Wegmans and Tops are getting them next week, as well as smaller one mom and pop stores. So I would suggest that people contact their pharmacist, and if you want to be put on the waiting list, you could contact the Erie County Department of Health to be put on the waiting list. I do not know when your time will come in which we will be able to contact you and say we have an appointment available for you, but you can contact the Erie County Department of Health. We very soon will be activating a new appointment system through Microsoft. We've entered into contracts. It's actually being designed and programmed for our system right now. Larry Schwartz from New York State said, fine, go ahead and do it. We know there's been problems with the state site, so Erie County's putting up our own coronavirus aid for the different type of appointment system. And at the same time as we open that, we will be opening up a specialized call center for vaccines only for the county's site. So you don't necessarily going to have to, in the future, just call the state site. You can also call not open yet, but soon to be open, a county call center for vaccines. Our goal is to have that open, hopefully, at this point by St. Patrick's Day. It was a 3-week window from when the contracts were signed to when the program had to be completed and set for the county system. So at the rate we're going, we're hoping to have this up and running by St. Patrick's Day. In the meantime, you can use the system that we have to get on the waiting list, or you certainly can contact a local pharmacy or a federally qualified health center. Some of the federally qualified health centers are getting them, and receive doses. I know it's tough. People want them. We get it. We want more people to get them, especially based on the percentages that we've seen across the county. And I'm really happy we're getting more doses. The first week we got a substantial amount of doses. We got 7,500 doses. It then dropped to 4,000 and then 1,700 for weeks on end. This week we're going to get more than 7,000 doses, and we're going to get all 7,000 of those doses into the arms of our residents in the upcoming week. WBFO, Mike Desmond.
Yeah, Mark, looking at the numbers for those east side zip codes that were supposed to be using the Delavan Grider Center, which is centrally located, bus lines, all of this stuff, did FEMA do a good enough job of telling people in those 10 zip codes that you can go and get a shot in your neighborhood?
Well, I will note that the clinic opens tomorrow, and it is running through on these first doses in March the 23rd, and as of earlier today, tomorrow, which is March through March 13th, all the slots were taken. So, and there's around 860 slots a day. So thousands of individuals have signed up, and they come from these zip codes. What we are a little surprised to see is not more have. And I've been talking with our partners in the community about this. I've been reaching out to others and trying to spread the message that if your loved one doesn't have social media, you can help them still by calling the phone number and scheduling an appointment. So I'm glad that thousands have signed up. I mean, we know that's the case. There's 10 days of full slots of appointments. So that's good. But there's thousands of more. And seeing these numbers and the low percentages of who've been vaccinated in the city of Buffalo is very, very disheartening. I mean, if you live in 14211, 14212, you're very close to the Delavan Grider Community Center. It's not that far away. 14215, 124, 208, fairly close. 207 and 210, not that far away. Blacklock Riverside, on the other side of the city of Buffalo, but still, you can get there. I don't know if they could have done, well, let's put it this way. Mike, you could always do a better job if you constantly spend all your time and effort trying to get information out. I will let you know something Erie County is done. We partnered with our local health equity task force, who are calling individuals that we know are at risk in these zip codes right now and helping them schedule appointments. Just since last night, there were about 650 appointments that were taken today for later this month. So we know people are getting them. I want to thank the members of the Ignite Hope Task Force, led by Pastor George Nicholas, Pastor Kinzer Pointer, our friends in the medical community, Dr. Raul Vasquez, Dr. Levan Ansari, Dr. Myron Glick, Reverend Mark Blue. They all believe that we have a role to play, and they've been playing it. And that's why the Health Task Force has been calling individuals that are at risk in these zip codes saying, we will help you get a vaccine appointment on the phone right now. So we're working it, and maybe FEMA could have done a better job, but we're doing what we can to ensure more people get vaccinated. WBEN, Mike Backerman.
Hi, Mark. We haven't heard from the governor since last Wednesday on anything even related to coronavirus. Usually he uses those briefings to announce whether something's opening or whether something's closing. Is there a concern that you have that we haven't heard from the governor in the last week related to coronavirus, and that we have no idea what a timeline looks like in future for this virus, be it the vaccines, be it opening parts of the economy? We haven't heard anything from the governor, who's got the most power in this.
Well, we have heard from the governor's staff. As I said, last night I was on with the vaccine czar of New York State, Larry Schwartz, late. It was after 10 o'clock. And I've talked with other members of the governor's staff in the last few days. And that's truthfully where we get most of our information from the County Department of Health, is from our contacts in the governor's office, as well as from the Department of Health gets information from the New York State Department of Health. I do know that the governor has not had a press conference. I think we can all assume that there's a potential reason why, at least in the last few days. It's important that any of us that are in these public-facing professions, especially if you're an elected official, do respond to the comments, questions, and needs of your constituents. I understand it's a delicate situation, and I do agree that the investigation that the Attorney General's office has commenced needs to move forward. It needs to move rapidly, but it also needs to be a fair investigation. I think it's important that we get accurate information from the governor's office, and we are. It may not be coming directly from the governor, but we are getting accurate information from the governor's office. And just example, the information you see on the screen regarding vaccination distribution by zip codes, that is from the New York State NICES system, they call it. And we were able to get this information from help from the governor's office in pulling it down by zip codes. So it's not as if there's no communication. There is. It just may not be coming directly from the governor, but there is communication coming to us, and we share that information. That's why we're able to provide these updates on a Tuesday, is a lot of the information that we get comes from New York State. Buffalo News, Sandra Tan.
Thank you. So just want to make sure. So for the 7,200 doses that first doses that Erie County is getting this week, you're going to go first to the folks who are already waitlisted, who are 65 and older, who qualify. For folks with comorbidities, are you still handing over your doses to the hospitals, or will you guys be vaccinating folks with comorbidities? What is the plan there?
Yes, we will. They still want it. So we will be providing it. As we said before, it's for outpatients and inpatients. Not every inpatient is at risk for COVID-19. If somebody went in for shoulder surgery, they're not necessarily the same as someone who may be at risk on the list for a lung transplant or a kidney transplant. So the hospitals best know who those most at-risk portions of their population are. As you said, we're trying to get those that are most at risk for death vaccinated quicker, especially out of the comorbidity population. And as a result, the 1,570 doses that Erie County will be receiving will be provided to the hospitals to continue vaccinating their most at risk in and outpatients.
And then for the essential workers, the 1,700 doses, is that only through the closed clinics that you've been talking about, or can anyone call who's an essential worker?
It's going to be a regular pod that's open to the public once we activate it. It's not been activated yet, but it's not going to be closed. So anybody who's in truthfully, the 1B category, that category will qualify. We think we're pretty close to finishing all police, fire, and transit. Our goal was to finish it by the end of today, but because of the little hiccup with those who took the appointments, we're going to have to do some work on the side, so to speak, to help finish that. But based on the information we've had, and we've been in contact with the cities, the towns, the villages, and the NFTA, based on not only what we've done, but what others have done, we think it's very likely that the police, fire, dispatchers, and transit workers will have all been vaccinated by the end of this week, at least those who want it. So that's why we'll be able to open up this general pod to the 1,770 doses for what would be considered essential workers, which also includes teachers and others who currently qualify right now, taxi cab drivers and the like, but it'll be an open system in which it is available for others. Politico, Marie French is on.
Thanks. Hey, can you hear me all right?
Yes.
Okay, great. Yeah, you touched briefly on the possibility that the governor might need to resign if the allegations are substantiated. I want to ask you about Lieutenant Governor Kathy Hochul. Do you think she would be able to step in smoothly to this role, and do you have any other thoughts about her, ability to do that?
Well, first off, once again, it's a hypothetical, But I will note this, as somebody who's known Kathy Hochul for a long time, she's ready for any type of role that you may have in government. She was a member of, she's actually served, I should say, at all levels. She was a member of the Hamburg Town Council for quite some time. She was our county clerk. She understands county government. She was a congresswoman. And for the last number of years, she's been lieutenant governor. She's got plenty of experience at all levels of government. And I know that Kathy is qualified for any job in New York State government. Because if you're lieutenant governor, you've got to be ready to step up just in case something bad happens. We certainly don't wish any ill will on any individual, but sometimes lieutenant governors have to step up to the plate. And in this situation here, I've known Kathy Hochul for a long time, and I know she's more than capable to handle any role in New York State government, including governor.
And can you speak a little bit to the role she's played in the response to the pandemic?
Well, I can tell you that she's been at the key position associated with the Western New York region, attending all of our phone conferences, including on the vaccine hub call. So she's been intimately involved. She knows all of us very well in Western New York, but I think she knows even more of us more than she ever thought she would, as we've worked very hard for almost a year now, at least in Western New York, to respond directly to the COVID-19 pandemic. I can't speak on some of the things she might have done elsewhere, but I can confirm that she's been actively involved with regards to the COVID-19 response as it pertains to Western New York, not only for the direct COVID-19 response, but also vaccine as a key member of the vaccine hub leadership. And Kathy and I talked a lot during the last year about getting resources, what we need in county government, especially early on when it was very difficult to try to just get testing kits and the like. So she's been pretty involved, at least as it pertains with me, and in discussing what we need in county government and how she could help as lieutenant governor since pretty much day one of the COVID-19 pandemic, as it matters for Erie County. As I say, I can't speak about other places, but I know what she's done here and how she's worked on our behalf, and she's worked very hard. B News, Ethan Powers.
Hey, Mark, can you hear me?
Yeah, I can hear you, Ethan. Go ahead.
Oh, fantastic. Good to hear from you. Thanks for taking questions. I wanted to ask you about your take on where things stand as we head into the spring. We've seen a lot of reasons to be optimistic in recent weeks with vaccinations accelerating and new cases falling, but at the same time, some reasons to be hesitant as well, with more contagious variants making their way as restrictions ease and reopenings begin. I won't ask you about a time frame for normalcy, but what's your take on where things stand currently, Mark? I mean, do you believe Erie County is in a good position relative to other places within the state and across the country at this point?
Well, I thank you for not asking about when we return to normalcy, because only God knows the answer to that question. But we are in a better position. We certainly are much better than we were in November and December, when it was really ugly and the caseloads were exploding, and we were put into the yellow and orange zones. We've worked hard to reduce those numbers. And people in the community have worked hard. I know people would like to just return to normal, and that's not going to happen anytime soon. What I think we need to understand is it's still going to take months to vaccinate the vast majority of the population. The president has given his word with regards to getting more vaccine doses out, and they're doing that. That makes a big difference, but we're still a couple months away probably from finishing off the 1B category, and I'd like to see that done sooner rather than later. So we just need to understand, for the time being, we need to continue to wear our masks when we're out in public. You can't safely socially distant. To follow the rules and protocols. They're in place to save lives. It's as simple as that. More than 1,600 Erie County residents have died in still less than a year from COVID-19. And unfortunately, more people will die. And there are probably people in Erie County and Western New York who have not caught COVID-19 yet, who will catch it and die from COVID-19. It's just a matter of percentages. We have a large population as compared to other parts of New York State, other than New York City area. And we know that a certain percentage, once they catch it, they have a higher risk of death. So I just ask everyone to continue to follow the rules as best as possible, to do your part to ensure that we're protecting our neighbors. We are our brothers and sisters' keeper. We have a responsibility not only to protect ourselves and our immediate family, but those around us. And I know we all want to get back to normal. Lord knows I want to get back to normal. I'd love to go on vacation. Some of us have been working pretty much nonstop for months now, but it's not time yet just to treat things like, hey, let's go to spring break. No, it's time to still do the right thing to protect your family, to protect your neighbors, protect your loved ones, and protect people you don't even know. Because that person you don't know may be a higher risk for death from COVID-19 due to an issue that they have than you are. Just like you walking down the street or at a location where someone else has COVID-19 and they're asymptomatic, but they pass it to you, and maybe you have a immunocompromised position and you haven't gotten vaccinated yet. You're highly at risk for death. So please be your brothers and sisters' keeper, continued. We try to keep these to an hour. We've gone an hour. We had a lot of questions. I want to thank everyone for participating in our update today. We will continue to share more information as we get it. We are still on the goal of keeping one COVID-19 weekly update, and if we get more information, we share it from either Department of Health or myself. So keep an eye on our social media pages. We will share information there, whether it's Department of Health, the County of Erie, or myself. And please, as we go through this month, especially what was affectionately referred to earlier, St. Patrick's Month, and we have Dingus Day come up. I know a lot of people are going to party and have a good time. We are still seeing COVID-19 transmission among small groups, especially those that are at private parties and are not wearing masks. So remember that. And to my friends in sunny LA, my hometown, I do not want to see my hometown as the highest percentage of COVID-19 cases next week. Let's get it together. You heard me. Be safe and well, everyone. Take care.